next subject in heart health is going to be diet and cholesterol. So when we look at cholesterol in the body, it's often one of those annual labs that your doctor looks at. It's a little bit more complicated than what is shown on the paper. So we have our LDL, which is low density lipoprotein, and HDL, which is high density lipoprotein. I always remember the two as HDL being the happy one or the good one, and LDL is the not so good one. But it's really an umbrella term. So when we look at our labs, we need to think about not just LDL, but what particles are there and what markers for true cardiovascular disease are there. And I would highly recommend you ask for lipid subfractioning, where they take those LDL proteins and they break them down further, and they look for components that are attached to those molecules to see what your true cardiovascular risk is. Triglycerides are often linked to how much sugar you're eating in your diet, and we want to think about that because sugar creates inflammation in the body and damage to the vessels and can create an imbalance where we see type 2 diabetes come on board, and of course can be linked to an unhealthy weight. Two of the herbs we're going to talk about that can help with blood sugar regulation as well as clearing out any of those unhealthy lipids are amla and garlic.